guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you from the Johnson City Performance Medicine today. I've got a special guest, Kelli Rogers, my daughter, who has been in charge of the performance medicine aesthetic for how many years now?
I'd say upwards of almost 20.
20 years.
I'm kidding. 12.
12, okay. I thought you were a little younger than that, but it wouldn't surprise me because time flies for me. You told me it was because I was going downhill.
Yeah,
Things go faster downhill. You told me that. So thank you, Kelli. But
you're welcome.
So you've been doing this for 12 years, and it's been very successful. At Performance Medicine, really what I try to do is make people healthier as they age. Look at nutrition, their weight, their exercise patterns, their sleep, and of course their hormone levels. But really an essential part of aging well and feeling good about yourself is aesthetics, making sure that you don't have too many wrinkles and dry skin, all the stuff that really women think about more than men, but men are starting to hop on board. But in any event, I'm going to talk to you today about a couple things that you do that have really fascinated me, that really work really well. As you know, a lot of what I do is geared towards weight loss. And now that we have tremendous tools for weight loss, permanent weight loss, through the weekly injections and different kinds of nutritional patterns and supplements, but we see a lot of weight loss in people. But one thing that we've noticed is a lot of people tend to get more wrinkly skin. And the main thing, a lot of my patients, especially baby boomers over 50, is they get areas that they just can't get rid of, usually around the midsection, belly fat. No matter what they do, they cannot really get rid of a particular part. It's really hard to target a particular part of your body and lose that weight. So there is technology now that we can use and that we do use to target that abnormal fat, whether it be around your midsection or backs of arms.
Bra fat.
So Kelli, tell me about these different machines you have, kind of how they work. What are people worried about? Is it the fat around their belly, their backs? Tell me what you experience.
Typically, when people come to me, their main thing is probably their busted can of biscuits. It's when you have your jeans zipped up and you have your shirt on and out the fat rolls. It's just a little can of biscuits, when they bust. So really, I just help them find, what's their trouble area. Normally for women, it's their stomach. And this just kills your fat cells. This is the laser. The physique is the laser, and the evolve is radiofrequency. So the difference being, if I want to debulk somebody, I will typically pick the physique, and I'll put it on the SDM, which is actually the super luminescent diode matrix. And it's just got a little bit better coverage for that. And it goes a little bit deeper than the radio frequency. This also has EMS, which is electric muscle stimulation. So that's something that you don't get at the gym. It's actually forced contractions with your muscles. So you could be just lying there and you've already done 1,000 sit-ups while watching Tabitha Salon Takeover.
Okay, you hooked me up to that one time, and
yes,
you hooked my abs up to it, and it literally felt like my abdominal muscles were jumping out of the skin. It felt kind of cool, but you also turned the other thing on, and I didn't feel like it doesn't burn. It certainly doesn't hurt. Do you ever get anybody that complains about pain from this procedure?
No, not at all. I mean, sometimes it can get a little hot, and we just put a little bit more ultrasound gel on it, but unlike other machines, this does not hurt. It actually feels pretty good. And you need about 6 treatments typically, and then maybe maintain after that once every couple months. But everybody's different. Everybody's body's different. So typically I like to burn the fat with the SDM, and then I like to flush it out with EMS.
So it's not painful. And it permanently gets rid of fat.
Yes.
Okay.
Although if you gain weight, you're going to get new fat cells.
Okay.
I mean, so when people typically, go on vacation, they'll do this like 6 weeks prior. They'll go on vacation. Obviously, they eat, and don't really watch their diet too well. So they'll come back like a month later, burn those fat cells, because we're constantly getting fat cells. As women, we have more than men. So this is a great tool for men too, obviously, that visceral fat area. And actually, we've measured visceral fat on patients before and after this, and they've lost quite a bit of
with
the
the
visceral
in-body
fat.
machine.
Yes,
we have
with our
downstairs,
in-body machine.
which is very accurate, what I call a truth machine. So how long does it start to take before they notice that they're decreasing fat in that particular area?
Well, if they're in a good positive headspace, they're going to notice the next week. The key is, don't be down on yourself. Your body listens to what you tell it. If you say, I'm not going to lose weight, you're not going to lose weight and you're not going to look better. So you have to positively reinforce yourself, and the weight will come off. I'm sorry, not weight, inches. That's what we do, inches. We had a patient the other day. She's lost 3 inches in a week. I mean, so it's, I wouldn't look at it scale wise, but as far as like how your clothes fit, I would say at least after the second or third treatment, you're going to start really seeing, you're just more comfortable in your clothes. You're not having that busted can of biscuits. Your thighs aren't rubbing feverishly together.
Can you use it on the back of your arms as well? Or?
Yeah. Mm-hmm.
Okay.
Yeah. That's
How
another.
about inner thighs?
Mm-hmm.
Okay.
Also, when you do this, a great thing to pair it with is our Deep Virtue RF machine. It's our microneedling for the body. And we have body pieces. We don't have this machine here right now. It's in one of our rooms back there, but it's going to help with crepiness of skin, and it's also going to melt fat as well, like cellulite and all those.
So cellulite, it's good for that. So how about under the chin?
Yes.
Okay. How do you do that?
Just like, regular microneedling, but this one it just goes a lot deeper. So if you got that double chin happening, that is an awesome thing to do. It's better than some of the injectables, I would say.
We use Kybella. You think it's comparable to that?
So yeah, it's very comparable. I would do this over Kybella just because Kybella is a little bit painful, from what I've heard. But they both work very similarly.
Yeah, Kybella. It seems like you have a big flap there for a while.
Yeah, you look like a croaking bullfrog.
for how long? A few days?
Just a year. I'm kidding. No, I wouldn't say days. I'd say maybe 1 or 2 weeks.
Okay.
From what I've seen.
So this doesn't do it when you use the other
No.
Skin needling? Okay.
No, there's little to zero downtime with that. And there's no downtime with these two machines. We have a lotion right here that we massage in for about 2 minutes afterwards to kind of get that, stimulation going, and then it just flushes out.
Is there a new type of lotion you were telling me about?
Yes, that would be this one.
Tell me about that.
The Body Firm. So what this does is it dehydrates fat cells. So you want to rub it in pretty good. When it comes to like a body lotion that's, on the more expensive side, you want to just target an area. Like, so if your stomach is your trouble spot, massage into your stomach once or twice a day, and it really will help. You need to have good lotions on your body. I mean, our face is just a little part of our skin. I mean, our body is, and bikini season. I mean, it just all the things. And also what's in for the men, as in women, like for women now thong bikinis are in. For men, it's Speedos. As you were wearing to the beach a month ago.
No, right? You did not see me in a Speedo. But anyway, so that's really interesting. So do you try to complement, maybe, do you use both of these at the same time on somebody sometimes?
Yes, I do. So I call
I would
it.
do. If I had a problem, that's exactly what I would do.
You can
Tell me
literally
how you do that.
cover your whole body with this. So I would do, if you wanted your thigh, so I would do the physique, and I've done this before on a patient's thighs, and then I will have the EMS with the Evolve, the muscle, the tone, the muscle stimulation going on in the stomach. So you're having the contractions, and you're also having the SDM, the fat burning, the debulking in other areas. And then you could switch it up, and you could stay here for days just debulking.
So how long would you say it really takes to show a difference in inches? Now, you were saying a week or two. I would think it'd take a little bit longer than that.
Clinically, 3 months after.
3 months? Okay.
That's when the clinical indication ends. It's 1 to 3 months after your last treatment.
And you like to do measurements and kind of...
Yes, we do measurements, pictures.
You do before and after pictures?
Mm-hmm. Yes.
Let's put some of those on here.
Okay, yeah.
We'll try to include some of those on there. But,
Yeah.
So you've had great results. You've been doing this for 2 or 3 years?
Yeah. 3 years probably with the Evolve 2, with the Physique. They work really great together. They're very similar, but using both, you can cover more areas, and you can have different things going on at different body parts.
Okay. You know, with all the weight loss stuff that we do, and now we've got these unbelievable tools like the Zepbound, and we have all the Wegovy and the once-a-week shots that really help you lose a lot of weight and actually help you maintain the weight. But you're not going to spot reduce with those shots. I mean, those
you can't
shots
target your areas.
They're amazingly effective for weight loss and a bunch of other stuff as well. You know, I talk about it all the time, the advantages of being on these GLP-1 agonists are just phenomenal. Now we have the Mounjaro or Zepbound with the GIP addition to it. But what I've found is that, in my experience, what you need to do with those things is work your dose up to the highest dose that you can tolerate, which is usually all the way up, and get your weight to the desired weight or inches, and then slowly back down, but stay on the lowest dose you can to maintain the weight loss, because it is a metabolism problem. It doesn't have anything to do with willpower or anything, but so that we've got a great strategy. But when it comes to lax skin and spot reductions in areas that you don't like, because as you age, you get areas that you really, especially around the midsection, that you want to get off. You've done all the work. So this gives you a really good tool. I mean, the technology on these things are incredible.
It is, yes.
You know, a few years ago, we were considering getting the cool sculpting, but decided on these because I think you get more consistent results, certainly less pain, less gap areas. Is that what you would come up with?
Yes. And it's great for, you know, for a lot of women that have had babies and their muscles have been torn apart. This can put that muscle wall back together with the EMS, which is really great. And if you've lost weight, you don't want to be sag and bag and bury. I mean, you want to be taught. So this gets you taut.
Taut, meaning tight, I guess.
Yes.
Is that a French word for tight?
Yes.
Taut. Okay.
Taut.
And sag and bag and what?
Sag and bag and bury.
Bury, what does bury mean?
It just means it was an old skit on the show All That, and Sag and Bag and Bury was a young boy who had very saggy clothes, and he just didn't look quite right with all his sagginess.
Oh, and his name was Barry.
Yes.
Okay, I didn't know that. See, these young kids, this millennial, whatever generation you're in.
Millennial.
I don't understand them sometimes. But anyway, so if you have areas of fat that you can't spot reduce, which is virtually impossible, come check this out.
Come check it out. Come see me. I'll let you know exactly what's wrong with your body. I'm kidding. But we can target what area you need, and then we will get you on one of these machines and get you going, get you a self-help book to encourage yourself along the way. I do believe that is very powerful.
I like your philosophy on that.
Yeah, your body will listen. If you say, I'm fat, your body's it's going to say, let's get fat. Let's get fatter.
Yeah, I agree 100%. Well, Kelli Rogers, thank you so much. I know you do a lot of other stuff. We'll have you back on the show, but we will see you guys next week. Hopefully you learned something. We'll talk to you next week.
Thank you.